PA student, Angel. I'm going to be doing a neuro exam on you today. Is that okay? Okay, we'll start with cranial nerve 1. I just want you to plug one nostril and stiff in. And the other side. Good. Nose is painting bilaterally. Okay, now I want you to close your eyes and plug one nostril and tell me what this is.
Mint.
Good. And the other nostril?
Coffee.
Good. Cranial nerve 1 is intact and equal bilaterally. Okay, now I just want you to look straight at me. Good. Good. Straight at me. Good. And now follow my pen in towards your face. Pupils are equal, round, and reactive to light and accommodation. And now I want you to follow my pen with just your eyes and keep your head completely still. Good. Keep your head still. Follow it. Good. Keep your head still. Good. Extraocular movements are smooth and intact without nystagmus. Okay. And I want you to, I'm going to check your visual field, so just tell me when my fingers come into your view, okay?
Yes. 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 Yes.
Good. Cranial nerves 2, 3, 4, and 6 are intact and equal bilaterally. Okay, now we'll test cranial nerve 5. So I just want you to close your eyes and tell me if you feel the sensation, if it feels the same on both sides.
Okay.
Close. Ophthalmic,
Yes.
maxillary,
Yes.
mandibular. Sensory branch of cranial nerve 5 is intact and equal bilaterally. Now open your eyes, bite down. Good, bite down, and move your jaw from side to side. Good. Temporal masseter muscles and motor of cranial nerve 5 is intact and equal bilaterally. Now we'll test cranial nerve 7. So what I want you to do is make a real surprise face, raise your eyebrows up. Good, and puff out your cheeks. Good, and grit your teeth so I can see them all. Good, close your eyes. Don't let me open them. Cranial nerve 7 is intact and equal bilaterally. Okay, now I want you to tell me when you can hear my fingers. Close your eyes and plug one ear.
Yes.
Okay, and the other side?
Yes.
Cranial nerve 8 is intact and equal bilaterally. Now we'll test your gag reflex in cranial nerves 9 and 10. So I just want you to go ahead and open up. Good, we'll test your gag. Gag reflex is intact bilaterally, and say ah. Palate rises symmetrical, uvula is midline, cranial nerves 9 and 10 are intact and equal bilaterally. And I want you to shrug up your shoulders. Good, cranial nerve 11 is intact and equal bilaterally, and stick out your tongue and move it from side to side. Good. Tongue is midline without deviation, no fasciculations. Cranial nerve 12 is intact and equal bilaterally. Okay. And we'll go ahead and test your deep tendon reflexes. So I just want you to relax the best you can here. Just kind of let your arms float like this. Good. Biceps. Good. And relax. Brachioradialis. Good. And triceps, this one you really got to hang on my arm here. Just really relax. Good. Good. On the other side. Good. Now your patellar reflex. Just relax. There you go. And Achilles, relax. Now I'm going to test your Babinski. This might be a little uncomfortable, okay? Let me try that again. Okay. I'm going to test ankle clonus. Deep tendon reflexes are 2+ and symmetrical. Babinski is negative, and ankle clonus is negative bilaterally. Now I'm going to test tactile discrimination, so I want you to close your eyes. This is what sharp feels like, and this is dull. I want you to tell me if you feel sharp and dull every time I touch your skin. Okay? I'm going to start at your face, so don't be alarmed. Ophthalmic.
Sharp. Sharp.
Maxillary.
Dull.
Mandibular.
Sharp. Dull.
And down on your arms. T1.
Sharp. Dull.
C5.
Sharp.
C6.
Dull. Dull.
C7.
Sharp. Dull.
C8.
Sharp. Dull.
Down on your legs.
Sharp.
L3.
Dull.
L4.
Sharp. Sharp.
T4 is at the level of the nipples, T10 is at the level of the umbilicus, T12, L1, and L2 are at the iliac crest inguinal area. L5,
Sharp. Dull.
L5,
Sharp. Dull. Sharp.
and S1.
Sharp.
Tactile discrimination is intact and equal bilaterally. Now we'll test light touch sensation. I already did the face with cranial nerve 5, so we'll go ahead and start down on your arms. Close your eyes. And tell me if you feel the sensation, if it feels the same on both sides, okay? T4 is at the level of the nipples, T10 is at the level of the umbilicus, T12, L1, and L2 are at the iliac crest inguinal area, and light touch sensation is intact and equal bilaterally. Now I'm going to test vibratory sensation. I'm going to test this on your thumbs and then your big toes. What I want you to do is close your eyes and then tell me when the vibration starts and when it stops. Other thumb. Now I'm down on your toes.
Yep. Stop. Stop.
Vibratory sense is intact and equal bilaterally. Now we'll test proprioception. Just put your fingers out like this and close your eyes. This is up and this is down. Tell me which way to move your finger.
Down. Up.
Good. The other finger. Now I'm down at your toes.
Down. Up.
Proprioception is intact and equal bilaterally. Now I'm going to test graphesthesia, so just put your hands out like this. Good. Now I want you to close your eyes and just identify the number I draw on your hand.
3. 2.
Graphesthesia is intact and equal bilaterally. Okay, now you can open your eyes. I'm just going to test rapid alternating movements, so I want you to put your hands down on your thighs and copy the motion that I'm doing, lifting your hands completely every time. Now faster. Good. Good. Rapid alternating movements are intact and smooth bilaterally. Now I want you to touch your finger to your nose and reach out to touch my finger. Good, really reach. Good. And the other hand. Good. This movement is smooth and intact bilaterally. Now I want you to close your eyes. We'll do heel to shin. I want you to take your left heel, close your eyes, and run it from your right knee down to your right toes and then back up again. Good. And the other one? Good. Movement is smooth and intact bilaterally. Now I want you to go ahead and stand up. You can open your eyes, sorry. Stand up. Now I just want you to stand with your heels and your toes together. Completely together, your toes together. Good. And just balance there with your eyes open for about 5 seconds. Good. Now I want you to close your eyes. And I'm going to make sure the patient doesn't drift. And can you raise your hands up parallel to the ground with your hands palms towards the ceiling? Good. I'm looking for pronator drift for hands to turn over and float down. And you can open your eyes. Romberg and pronator drift are negative. Okay. Now I'm going to test your gait, if you just want to start over here by the wall. And I just want you to take a normal walk down a few feet, turn around and go back. Turn around. I'm looking at her balance and her strength and her coordination. Now I want you to walk away on your toes. Good. Turn around and go back on your heels. Good. Now I want you to walk away going heel to toe like on a tight wire. There you go. Good. Turn around. Good. Gait is intact with appropriate arm swing and stride.